Professor, thank you for sparing the time to give evidence. Can you hear and see us okay? My name is Charles Fielding and I am the lay chair of this Professional Conduct Committee. My fellow panel members are David Salisbury, who is a DCP, and Fiona Sanderson, who is a dentist. The legal advisor on my right is Rupert Sandbrook, QC. In line with the GDC's policy of not identifying patients or witnesses, we shall refer to you as Professor M.
Professor M, thank you for agreeing to give evidence today. I am representing Dentist C. Could I ask you to confirm your full name and your qualifications and to explain your relationship with Dentist C, please?
I understand that you've been given my full name on a piece of paper, which has just been shown to me. I confirm that is my name. My qualifications are BDS Bristol 1972, DDS 1990, FDS RCS England 1999, MRD 1999. I have been Professor of Restorative Dentistry at the Eastman Institute for the last 9 years. I split my time fairly equally between clinical work on cases which are referred to me, teaching and research. I've known Dentist C in a professional capacity for about 15 years now. He has referred quite a number of cases to me over the years, so I know the standard of his work well. And he's worked with me at the Eastman on a number of occasions when we've held courses where practitioners bring in their own patients so they can learn complex procedures under supervision, with the patient's full consent, of course. He has worked with me on one significant research project and several small ones. I've always had a high regard for his skills and his judgment. I've always found him to be an extremely conscientious and careful surgeon who is meticulous about what he does. And he has a very impressive record of successful treatments and satisfied patients. I should add that he and I socialise occasionally. He's not a close friend, but we enjoy each other's company and shared interests when we meet at learned society dinners and so on.
Thank you, Professor. Could you describe his attitude towards his patients, please?
I have always been struck by his very caring and compassionate attitude to his patients. He wants nothing less than the very best for them and is always available to them, including after hours and at weekends. He has built up an excellent reputation for having those very qualities. He is well known in our dental circles for going the extra mile that way.
And could you tell us what you know about his communication skills?
In my experience, they're good. I've observed him often taking time to explain things to his patients, and he's always been clear and lucid with me. He's very enthusiastic about his work and what he can do for his patients. Sometimes he can get quite voluble and carried away when he's passionate about a matter, and I have had to ask him to slow down a bit. But it's not a problem for understanding him. It's a measure of how keen and involved he is professionally.
Thank you, Professor. I have no further questions, but my learned friend representing the GDC may have, so I shall ask you to remain online, please. As you have been told, I represent the GDC. You have given a very positive testimonial for Dentist C. May I ask if you knew about this case before you were called to give evidence?
Yes, I did. In fact, I think I was one of the first people Dentist C called to talk to when he first received notice from the GDC that they were following up the complaint against him. But he had anyway discussed it with me months before that as one of his very few cases which had gone wrong, which he regretted and wanted to learn the lessons from. So yes, I've known about this for a long time.
And what is your view about this case?
I think it was very unfortunate. It was marginal, but it could have worked. And if it had done, it would have achieved a very good result for the patient. I feel it was an unlucky combination of challenging clinical circumstances, a demanding patient, and a dentist who perhaps was too willing to try to help. If Dentist C had a fault, it was that he might sometimes let himself be persuaded to go too far towards trying to meet his patient's aspirations.
Would you explain yourself a little more, please, Professor?
Well, I've seen the x-rays, and I think that there was just enough bone there to support the implants, if all had gone well. He made a rare and not very big error in placing two of the implants too close together, and then they went out of line because of poor support from deteriorating bone. One of the fundamental requirements is excellent oral hygiene, and that is where it all went wrong. Dentist C knew that the patient was not good at maintaining his oral hygiene, and he did not manage to clear all of the periodontal disease thoroughly before he started, nor did he consider deeply enough whether the patient would ever reach good enough oral hygiene standards and then maintain them. He was keen to achieve a good result for his patient in challenging circumstances, and I think he allowed himself to be pressurised by a very demanding patient who was convinced that implants were the answer and he had to have them. In all the circumstances, perhaps the right course of action, which would have been in the patient's overall and long-term best interests, would have been to refuse to give him the implants he wanted. But that's easy to say with all the benefits of hindsight, and I know that Dentist C has taken that lesson very much to heart.
Thank you, Professor. Those are all the points I wish to put to you, but the committee may wish to ask you some questions.
I am looking at my colleagues and I see that they are shaking their heads. I have no questions, so I shall say thank you for giving your evidence, and you are discharged.